Our top story, today is the day. For the next 3 months, open enrollment under the Affordable Care Act, Obamacare, will give Americans a second chance to sign up for federal health insurance. One of the biggest problems last year when the program began was with its website, healthcare.gov. It crashed from the get-go and failed several times after that.
But the website has since had an overhaul. Kevin Cunahan, the man in charge of the site, says this time things should be much smoother.
We've had multiple ways in which we've kicked the tires on this system, both internally and externally, to see that it works and that it's stable.
Obamacare has 7 million paying customers, reducing the number of people without health coverage. Let's get some of the details, including new coverage options, penalties, and other legal challenges to the program. Wall Street Journal reporter Louise Radnofsky joins us this morning. Louise, good morning.
Thank you for having me.
Yesterday, I was reading an article, and the title was Higher Cost, Higher Penalties in terms of Obamacare. I want to talk to you a little bit about this. I should say healthcare, rather. What are people expecting to see when you look at the broader picture that's different from last year?
Well, there are more plans in more markets this year, but that's affecting prices that people might see. Big plans that snapped up a lot of consumers last year are raising prices. At the same time, some of the new market entrants are making aggressively low bids to try to undercut them, which in turn affects the value of people's tax credits. They're actually going down in many states. So the important message for consumers here that have been coming from advocates is that they have to go back to the website to shop. It's very important they do it, not just to get a better option, but to avoid getting a worse one.
What are the deadlines for the new open enrollment, Louise?
Well, it opens today. People have until December 15th to make changes to their coverage that can take effect January 1st. So that's a real key deadline for people who bought last year around. For people who don't have coverage right now and might be going to the site for the first time, they have until February 15th of next year to shop for coverage in most circumstances. Although, again, you have to have signed up by the middle of the month to have coverage that can take effect on the first day of the following month.
Is there a general consensus for who the people are, as you mentioned, that still don't have coverage at this point?
Well, there's more than 30 million of them. Some of them are not eligible to use the website at all to shop because they're not in the country legally. Some people have to have incomes that are too low to qualify for tax credits towards the cost of coverage because they live in states that aren't expanding their Medicaid programs. And some people have money, would qualify for tax credits or maybe even wouldn't, but don't feel like the insurance options available to them represent a good deal. They may be opting to pay the penalty this year.
Louise, the Obamacare has survived one Supreme Court challenge back in June, but now there's another. What basically is involved there?
Well, the law is headed to the court for the third time around, this time over the tax credits that the law provides for residents in exchanges. There's a debate over whether people who live in states that did not run their own exchange, that turned over some or all of that task to the federal government, can get those credits. And that's more than 30 states potentially affected.
All right, Louise Radnofsky, thanks so much for being with us this morning.